I am Miraida Italy, so I will be discussing what is internal feeding. Internal feeding is also called tube feeding or tube nutrition. It is a method of giving nutrition through a tube that goes directly in the stomach or small intestine. It is also used when the person cannot eat and swallow safely, but their digestive system is still works. And also, the importance of using IG tracts is using IG tracts keeps the stomachs and intestines active, maintains normal digestions, and prevents problems like infection or gut weakening. The advantages over parental feeding are it's more natural because it uses the digestive system, fewer complications and infections, it's more cost-effective and easier to manage long-term. And that's all. Thank you.
Good day everyone, I'm Amimarin Sanis. So for my part, I'll be discussing the types of internal feeding tubes. So, internal feeding is done kapag yung pasyente hindi makakain through the mouth. Pero okay pa rin yung pag-function ng stomach and intestine. So, use tubes para ma-deliver pa rin ang nutrients. So, first, we have the short-term feeding tubes. These are usually for use for less than 4 to 6 weeks. So, the first one is the nasogastric tube, also known as Inchi tube. Ito ay pinapasok mula sa ilong papunta sa stomach. So, ito ang pinaka-common kapag temporary lang kailangan ng feeding. So, the second one is the nasoduodenal tube or ND tube. Mula rin ito sa ilong pero ang dulo nito ay sa duodenum, which is the first part of the small intestines. So, ito ay ginagamit kapag kailangan i-bypass o iwasan ang stomach. The last one is the nasojejunum tube or NG tube. Wala rin ito sa ilong pero ang dulo naman ito ay sa jejunum. So, ginagamit ito kapag hindi na kayang tumanggap ng pagkain ng stomach o may risk ng vomiting at aspiration. Kaya diretso na sa small intestine. So, next is meron tayong long-term feeding tube, usually more than 4 to 6 weeks na kailangan. So, the first one is the gastrostomy tube or the G tube. So, direct ang nilalagay sa stomach through the abdomen. So, ginagamit ito sa mga pasyenteng matagal kailangan ng feeding. So, the second one is the jejunostomy tube or G tube. So, ito ay direktang nilalagay naman sa jejunum. Ito ang option kapag hindi na talaga pwedeng gamitin ng stomach. So, the last one is the gastrostomy and jejunostomy tube or GG tube. Combination siya ng G tube and J tube. May part para sa stomach at may part para sa jejunum. So, for the feeding methods naman, we have the first one is the bolus feeding. Binibigay ang pagkain in larger amount, pero nakaschedule para siyang meal time. So, usually ito ginagawa para sa stomach active. Last one is continuous feeding, slowly and steady na binibigay over several hours gamit ang feeding pump. Ito kapag sa small intestine dahil mas sensitive ito. So, in summary, pinipili ang tube based sa condition ng patient, kung saan pwedeng dumaan ang nutrients at kung saan gaano katagal kailangan ng feeding. So, that's all. Thank you.
Good morning, everyone. I am Alinazer Nachimpa. My assigned topic is all about indications of enteral feeding. Indications of enteral feeding refers to the medical reasons or conditions that make it necessary to provide nutrition directly into the stomach or intestine through a tube. Sa madaling salita, ito ang mga sitwasyon kung saan ang isang tao ay hindi makakain ng sapat sa pamamagitan ng bibig, ngunit maayos pa rin gumagana ang kanyang sistemang panuno. And number 2, when enteral feeding is appropriate. Enteral feeding is appropriate when the gastrointestinal or GI tract is functional, meaning the stomach and intestine can still digest and absorb nutrition. But the person cannot eat normally by mouth due to illness, injury, or other medical conditions. And example, when when it's appropriate. Difficulty swallowing, poor appetite or inability make nutritional needs already. Unconscious or comatose patient, severe burns, trauma or major surgery needing extra nutrition, and neurological or muscular disorder that affect chewing or swallowing. Then number 3 is clinical situation that require tube feeding. First is conditions. Reason for tube feeding, stroke, impaired swallowing. And 3, head or neck cancer, black or painful swallowing. Then coma or unconscious, cannot eat by mouth. And severe burns or trauma. And trauma increase nutritional needs for healing. Then neuromuscular diseases, weakness and muscles used for swallowing. Then last is major gastrointestinal to maintain nutrition and oral intake issues. That's all.
Good day everyone. So now I'll be discussing about the absolute contraindications. So let me give you a summary of external feeding. External feeding is a way of giving nutrition directly to the stomach or intestine when a person cannot be eat normally. However, it should not be used to certain situations because it can cause harm instead of healthy. So now, let's discuss the absolute contraindication. So means internal feeding must not be done. This include bowel obstructions, non-function intestines. So such as when there is a tissue that or no blood flow and uncontrolled GI bleeding. In these cases, the digestive system cannot handle feeding safely. So now, let's proceed to the relative contraindication. So relative contraindications are situations that require caution. This includes severe malabsorption, hemodynamic stability, or a poor blood flow to the gut, high risk of aspirations, and conditions like fistulas, severe infection, and abdomen. So feeding during these times may worsen and patient condition. Overall, external feeding is helpful when gut works properly, but it must be avoided or used carefully when the digestive system is already not ready. Proper assessment ensures the patient safely and effective treatment. So that's all.
Good day everyone. So let's move on to complication problems of internal feeding. Even though internal feeding is usually safer than feeding through the veins, it can still cause some problems. The first one is aspirational pneumonia happens when food enters the lung instead of the stomach, especially if the tube is misplaced or the patient has weak airway protection. Tube problem, the feeding tube can get clogged, damaged, or move out of place. Infection or leakage may occur at the site where the tube entered the body. Gastrointestinal intolerance symptoms like nausea, vomiting, diarrhea, constipation, or stomach bloating can happen. Nasal or throat irritation, common with nasal tubes. Skin irritation, redness, or drainage may appear around the tube side. Refeeding syndrome occurs in very malnourished patients when feeding starts too quickly. Leakage into the abdomen happens if the tube slips or causes injury leading to stomach contents leakage inside. While internal feeding provides essential nutrition, it must be carefully monitored to prevent this complication and keep the patients safe.
Good day, ma'am. I am Giovanni Impaniangan, and today I will be discuss the feeding formulas and protocols. So, feeding formulas and protocols, enteral nutrition uses liquid formulas containing essential nutrients such as carbohydrates, protein, fats, vitamin, and minerals. So, the feeding formulas is the liquid foods like that contains vitamin, and we can take that through tube like inserting nastrogastric tube. And we have three kind of formulas. So first is the standard formulas for people with normal digestion and absorption. Ayan yung mga taong mayroong normal and walang problema sa absorption nila. In short, nasa stable yung digestion nila. And the second one is elemental or semi-elemental formulas for those with digestive or absorption problem. from the word problem, ayan na yung mayroon problem sa digestion nila or absorption. And the last one is the disease-specific formulas designed for condition like diabetes, renal failure, or liver disease. And ayan yung may mga sakit, ayan yung mayroon ng mga sakit. So now let's proceed to the feeding protocols includes. So the first is bolus feeding. It is given in a set volume several times daily. And the next one is the continuous feeding. And the continuous feeding is delivered slowly via a pump over several hours. So in bolus feeding, it's daily times is daily, and then the continuous feeding is oras yan, several hours. And the last one is the cyclic feeding, giving overnight to allow daytime freedom. Is yung cyclic feeding naman is like sa morning or sa gabi. And now, the special consideration. Infant and pediatric patients need age-specific formulas. So by age, meron siyang specific na formulas na binibigay. Magkaiba yung sa infant and sa adult. Thank you!